So let's begin with education. So what is education, and how is education associated with health? Well, education is indicative of a person's skills for acquiring positive social, psychological, and economic resources. Know that education is the strongest single predictor of health, and it is critical for onset of disease. So the question is, why strongest predictor and critical for onset? Well, a couple reasons and causal pathways. For example, education is associated with access and proper use of health information and management. For example, if one knows how atherosclerosis is associated with dementia, probably these individuals with such information will more effectively deploy their resources and take preventative measures to delay onset of this disease. And second, of course, education is associated with income, and income represents a wide array of pecuniary resources, financial resources, right? That can be used to prevent some disease or delayed onset of disease. And education is associated with cognitive skills, which can be used to process health information and make sound judgment, right? Including verbal, reading, writing, and mathematics. Okay. And how about the association between education and non-cognitive psychological factors like temperament or personality, like conscientiousness, discipline, right? After individuals learn certain diet, effective diet to lose weight, right? They got to use discipline, right? To make sure that they stick with a certain diet and follow through, right? So it requires discipline and sense of mastery. Next is income. Income reflects spending power, housing, diet, and medical care. And we do know that these elements are closely associated with risk factors and health outcomes. And income becomes more important over life course. So it is critical for prognosis. That is, after onset of disease, then gradually income going to take over, because the treatment of disease, right, requires sufficient financial resources. And a question I'm going to toss out, for example, here is, what if one lives in Canada or United Kingdom, not the United States? So here, I want to get into the realm of the association between inequality, especially income and wealth inequality, and health. So probably can pause here and think about it. Next major component of socioeconomic status in the United States, occupation. What is occupation, and how is occupation associated with health? Well, occupation obviously is associated with status, and we talk about status is about lifestyle. It is about honor. It is about self-esteem, right? And prestige. In turn, it's going to affect one's mental health on that account, right? In terms of prestige, self-esteem, and honor, right? And sometimes information and other non-pecuniary, non-monetary resources. Occupation is also about job demand and job control. How much work you have to complete within ascribed amount of time, and also about job control. That is how much say individual workers have over the content and a demand of their job. So a lot of times it is about autonomy, and also how much support workers receive from their peers and supervisors. Related to job demand, we have about, physical activity, how much it is involved, right? And sometimes it is about occupational disease, like how long white-collar workers have to sit in front of a computer, right? And that can lead to, an overuse of one's eyes and fingers, can lead to all kinds of kind of ergonomic issues. So health risks associated with one's job, for example, truck drivers sitting for a long period of time, right? They could have, spine issues. And as opposed to, let's say, professors. Next is subjective SES. So what is subjective SES? Well, subjective SES is a person's belief about his or her location in a status order. The theory involved in the construction of this concept would be, for example, relative deprivation in status. Okay, and if one feel relatively deprived, okay, or deprived relative to others, let's say in their community, in their country, or in their neighborhood, then that can lead to elevated level of some mental disorders and depression, etc., and stigma, right? Individuals can feel marginalized without social support, stigmatized, and even angry, right? Angry. And here I haven't really got into details about lifestyles, but we know that lifestyle is associated with status, and associated with education and income. Here for lifestyle, I'm talking about the kind of diet people are on and whether they have regular physical activities, things along that line. Okay, next, given our discussion about association between socioeconomic status and health, here I want to summarize the general pattern again, revisit actually. So about modern disease and poor. Chronic diseases are most associated with modernization. So here for chronic diseases and conditions, here I'm talking about obesity, cardiovascular disease, and cancer, and pulmonary disease. And they were associated with actually upper classes. The lifestyle changes among the affluent have reduced their risks of chronic diseases. Okay, so it began in a small circle of the rich, because they can have food with high content, proportion of like fat or cholesterol, very high cholesterol, etc. With the kind of food they had. But later on, they figured it out. So they make modifications to their lifestyle and things changed and etc. And poor are more likely to suffer from infectious disease, chronic illness, and mental illness during our era. So that is present tense. So in general, the poor have the greatest exposure to risk factors that cause illness, right? Physical conditions like poor sanitation, because poor sanitation poor housing. And second would be chemical, like pollution, right? Risk factors. Third one is biological, right? Like bacteria, viruses. So poor have more exposure to those because of, for example, living conditions or lack of access to healthcare, or it could be just, their built environment is not that livable, high quality. They have high psychological stress. And the economic factors like low income, unhealthy jobs, right? Menial jobs. And lifestyle issues like poor diets, smoking, lack of leisure time, exercise.